Hello, everyone. Welcome to our Zoom meeting. Today, we will have 4 topics that we are going to discuss. And when you are ready, we'll be happy to listen to you guys. Please go ahead.
Hello, Dr. Nader. How are you doing?
Very good. Thanks. How are you?
Fine, Dr. Nader. Thank you so much. Sorry if there is some noise around me. I have an urgent matter and I have to work from outside my home. I am in the car right now. But I will try to be as clear as possible.
Sounds good. Thank you so much.
Thank you so much. Can I start now?
Yes, please.
Thank you so much. Good morning, good afternoon, good evening, everyone. Welcome to today's session. My name is Ahmed Khalifa. I am the team leader of Team Canary 2, and I will be moderating today's session. We will be presenting a diverse set of topics that span clinical care, research methodology, digital health, and health system. We have today 4 topics and small 5 topics at the end before going to Dr. Nader for project update. And first topic will be about hospital medicine and will be presented by Dr. Areej, Elemam. Hospital medicine plays a central role in modern healthcare system, especially for older adults with complex medical needs. Understanding its structure and scope is essential for anyone involved in geriatric or telehealth-based care. Please welcome Dr. Areej, Elemam.
Assalamu alaikum. Hello, Dr. Nader. Hello, everyone. And I'd like to thank you for the opportunity to present today. So I will share my screen. Can you see my screen?
Yes.
Yes.
Okay. So I'm going to talk about hospital medicine, scope, roles, and impact on modern inpatient care. Our objectives today will be define hospital medicine and its scope, describe key roles of hospitalists, understand the impact on patient safety and quality, recognize challenges and future directions. So what is hospital medicine? Hospital medicine is just give me 1 second. So hospital medicine is a medical specialty dedicated to the delivery of comprehensive medical care to hospitalized patients, and it's managed by hospitalists. Hospitalists can be physician trained in internal medicine, pediatrics, or a family medicine. So any physician of this specialty can be a hospitalist. So what are the scope of practice in hospital medicine? It's not only restricted to clinical care of patients, but it's also involved teaching, research, and leadership, management of acute and chronic conditions, care coordination and transitions, quality improvement initiatives. Evolution of hospital medicine. Hospital medicine originated in the US mainly in the mid-90s. And by the 1996, the number of hospitalists in the US was less than 1,000. And the great evolution of hospital medicine started within the past 10 years. By 2014, the number of hospitalists in US reached 44,000 hospitalists. And by 2022, the number of hospitalists increased to more than 60,000 practicing hospitalists in the US. And it's not only present in the US, there's other countries like Australia and Canada, but it's originated and it's mainly evolved in the US. And it is the fastest growing medical specialty in the US. So what are the driving factors that lead to emergence of this kind of specialty and the high demand for it? The driving factors for hospital medicine driven by need for 24/7 physician availability in the hospital, focus on quality and safety metrics. And when I said quality and safety metrics, it means simply to use objective data such as rate of infection, patient for example, readmission rate of the patient, using of this objective data to measure how well care is delivered, ensuring it is effective, safe, and timely, and this will lead to better outcome and prevent harm, reducing care. Also, another factor for increase the demand for hospital medicine is the demand of cost effectiveness and efficiency by ensuring that resources like staff, equipment, and space, and even time are used efficiently. Also, another factor is emphasis on care coordination of patient. What are the core responsibilities of the hospitalist? At first, of course, admission management, initial assessment of patient. They put the treatment plan, and then their work is extended to daily care coordination, like making rounds, adjustment of treatments, communication with team, discharge planning, including transition coordination and follow-up arrangement, emergency response, 24/7 availability for acute situation, and improvement of quality by implementing evidence-based protocols. And this is achieved by a strategy that involving a cycle of questions and research, integrating it with patient and expertise value, applying it, and then evaluating this strategy, evaluating the result of this strategy to improve care and reduce cost, and of course, enhancing patient safety. The common conditions managed by hospitalists, sepsis, infections, heart failure, COPD. There is many conditions managed by hospitalists, acute kidney injury, metabolic disorder, respiratory illness, and also their role extended to the pre- and post-surgical care, pre-surgical risk assessment for heart attack, blood clots, and delirium, and post-surgical medical management, which is a co-management. So hospital medicine and patient safety, hospitalists are leaders in patient safety initiatives. Their focus area include medication reconciliation, which achieved by it is a formal process used by the healthcare professional to create the most complete and accurate risk of current medications used by patient. When I talk about the accuracy and details, this list should include the name of the drug, the route, the frequency, and even include over-counter medications, vitamins that are taken by the patient, and to compare this list with the medications ordered for the patient during his hospital stay. And the goal of this is to prevent medication errors like omission, duplication, and harmful drug interaction. And this kind of medication error usually or commonly occur during a transition of patient across different health facilities. So hospitals will play a vital role in this medication reconciliation. Also, prevention of hospital-acquired infection, early recognition of clinical deterioration. So they use a standardized protocol which improve the outcome and reduce errors. Also, we'll talk about the role in quality improvement. Hospital medicine is closely linked to quality and performance metrics. And this is achieved by targeting certain factors like length of stay, readmission rate, mortality and morbidity, and data-driven practices is a core component of this specialty. Interdisciplinary teamwork, hospitalists work closely with nursing staff, case management and social workers, pharmacy, physical and occupational therapy. So effective teamwork enhances efficiency and patient-centered care. And daily interdisciplinary rounds and work are a key feature of hospital medicine. Transition of care. Hospital discharge is a vulnerable period for patients, and this is what of the main job of hospitals. They should ensure a good and effective transition of care by accurate discharge summaries, medication reconciliation, and follow-up planning. So strong transition include reduce the readmission rate and improve continuity of care of patients. Hospital medicine and health system. Hospitalists contribute to hospital operation and leadership, and their role includes protocol development, clinical pathway, and resource utilization. So hospital medicine aligns both clinical work with the institutional goals. So what are the future direction in hospital medicine? They are directed now to expansion of telemedicine and remote consultation, integration of artificial intelligence and decision support tools, focus on value-based and patient-centered care, enhance collaboration with outpatient and post-acute services. So this is the requirements of hospitalists. As I mentioned, a hospitalist is a physician who is trained in internal medicine, family medicine, or pediatrics. So a residency in each of these three specialty is required, and there is no fellowship needed. The common schedule is 7 days of work and then 7 days off. Certain hospital settings involve 5 on and 5 off days. Their shift, it's almost 12-hour shift, so it's 160 to 180 hours per month. Their salary, the average salary is between 250 to 180 to 330,000 per year, and this is almost the same or a little bit less than the salary of the internal medicine. They got higher pay for nocturnist and rural roles. The career tracks of hospital medicine, nocturnist medicine, academic hospital medicine. Also, they can be in quality and patient safety, clinical informatics, and leaderships. So what are the pros and cons of hospital medicine? Pros for hospital medicine is focusing in inpatient practice only, predictable schedule, strong leadership and teamwork roles, and growing national demand. The challenges or the cons of hospital medicine is, of course, high patient acuity and workload, burnout, and work-life balance concerns, also increasing administrative responsibilities. So this are the main challenges of hospital medicine specialty. So at the end, the key to takeaways is hospital medicine is central to modern inpatient care. Hospitalists manage complex clinical conditions and system challenges. The specialty improves safety, efficiency, and quality of healthcare. Also, hospital medicine continues to evolve with healthcare innovation. So this is the end of my presentation. I hope that you learn new things today about hospital medicine.
Thank you so much, Dr. Areej, for that insightful, clear, and well-structured overview for the hospital medicine. It highlights how hospital medicine serves as the backbone of inpatient care and why it remains so relevant to interdisciplinary and general practice. Any question for Dr. Areej? Any questions?
Thank you so much, Dr. Areej, for this great presentation. If there is any question, please come and ask. And I'd like just to comment. So this is great presentation because some of you might be interested in knowing about this. And there are a couple of other like divided jobs within the hospitalist. Some work only at night, so it's like a shift based. So some people will work during the day, and then some other people will work at night. So just to recognize that some prefer to cover night shift mostly, nocturnist, and some people, hospitalist, will cover during the days. The schedule, sometimes it might be 1 or 2 weeks on and 1 or 2 weeks off, alternating also. So you work with a group of hospitalists, and it's up to you to decide, I want to work like days and I want to work 1 or 2 weeks, something like that. So you can run the schedule within the group there. So but thank you so much, Dr. Areej. This is a great presentation.
Thank you, Dr. Nader.
If no questions, we can move on.
Thank you so much, Dr. Nader. Um, Now we shift to the second topic, which is about thematic analysis and qualitative research, and will be presented by Dr. Malaz Salah. Qualitative research allows us to capture patient experiences, clinician perspectives, and system-level insights that numbers alone can't show. Thematic analysis in particular is a powerful and widely used method in health research. Please welcome Dr. Malaz Salah. Dr. Malaz, are you with us? Dr. Malaz Salah, are you here?
Hello, everyone. I'm so sorry. I have technical issue.
No problem. Now, Dr. Malaz?
Hello.
Are you ready now?
Yeah. Let me just
You
share the screen.
can go ahead and present. Take your time.
I'm so sorry, actually. Just I have a technical issue. Good afternoon, everyone. My name is Malaz Salah. I'm Dr. Malaz Salah, and today I will be sharing a clear and practical overview of thematic analysis as a qualitative research method. And I will talk through the concept step by step, keeping the discussion simple, connected, and grounded in a real health research example. And to guide the presentation, these are the main objectives. By the end, we should have a clear understanding of what thematic analysis is, how is applied in practice, and when it's the most appropriate method to use in qualitative research. And how we're gonna identify appropriate situation to use the thematic analysis. So moving firstly to know what is a thematic analysis. In simple terms, thematic analysis is a method we use to identify and interpret patterns of meaning within qualitative data. So that means it will help us understand not just what people say, but what their experience mean in relation to the research question. And thematic analysis, it's focusing on understanding experiences, beliefs, and perceptions in relation to specific research aims and questions. And so that, as I said, it's literally help us not just to know what people say, but even so, we're gonna be involved within their experience in the meaning and how the meaning is related to the research question. And after know the concept, next question, it's what type of data we can analyze by using this method. Thematic analysis, it can be applied to interviews, focus group discussion, open-ended survey responses, and written documents. So that means we can apply it in primary research and in secondary research. So as we know that primary research is referred to the data that is collected directly by researcher for a specific study, such as interviews, as I said, or focus group. And secondary research, it's on the other hand involve analyzing data that has already been collected by others, such as report, policy documents, or published qualitative studies, and so on. So, I'm sorry. I'm sorry, literally, I'm facing the technical issue. So, moving to the types of thematic analysis, we have two types of thematic analysis. We have the inductive thematic analysis and deductive thematic analysis. So, in inductive thematic analysis, in inductive thematic analysis, the data we use, it's bottom-up and data-driven approach, and the codes and theme, it's made directly from the data. So it's commonly used in exploratory research. So that means we will gonna be exposed to the data from the beginning. And then we will gonna generating the codes, and then we will gonna generate the theme. As we will gonna know later, the steps will gonna be followed to generate the thematic analysis. And in deductive, we are going to from top to down, and it's a theory-driven approach, and we use predefined a priori codes, and it will be guided by the existing frameworks or theories. So that means we're gonna be started from the codes. Okay, so moving to the steps we're gonna be approach. We have to fix it, and we have to follow to uh, to do the thematic analysis, to apply the thematic analysis, which is called Brown and Clark's six-step framework. It consists from the six step, which is started with familiarization with the data, generating initial codes, and then searching for themes, review themes, and then reviewing themes, and then defining and naming themes, and then producing report. Okay. Starting with familiarization with the data. So, in familiarization with the data, this is the first step. We're gonna be reading and reread the data to gain a deep, holistic understanding. For example, when analyzing interviews with elderly patients receiving telegeriatric care, the researcher carefully we're gonna listen to how participants describe their experiences in their own words. This will let us to be familiar with the data, and will gonna help us to go into the next step, which is the generating the code. So once we have been familiar with the data, then we will going to generating codes by identifying and labeling meaningful parts. By identifying and labeling meaningful parts of the data that relate to the research question. For example, a statement such as, I feel safer after knowing I can speak to the doctor online. This statement may be coded like as a sense of reassurance. And then after coding, the researchers will gonna begin searching for the themes by grouping related codes together. Codes like reassures, for example, reduce anxiety and continuous follow-up may come together to form a broader theme that reflects a shared experience across participants. So at this stage, themes are reviewed to ensure they accurately represent the data during these searchings for the theme. Sorry, after searching the theme, we're gonna be reviewing the reviewing themes. In reviewing themes, we have to ensure they are accurately our themes represent the data. So we will gonna check whether each theme supported by enough data and whether it clearly captures participants' experience across the database. So what I mentioned for you, it's regarding to my example I was mentioned. As I said, when analyzing interview with elderly patients receiving telegeriatric search, this is the example which is actually speaking about it in each part, okay, in each step. And then step 5, we're gonna defining and naming themes. So clearly, we're gonna defining each theme, identifying the essence of each themes, and naming the themes concisely and meaningfully. And then step 6, which is the final step, in this we're gonna producing the report, selecting the illustrative codes, linking the themes to reach aims and questions, and interpreting findings in text. So after knowing the 6 steps from works of Brown and Clarkes, we will going to know the strengths of the thematic analysis and limitations. So regarding the strengths of thematic analysis, it's easy to learn and to apply, as we know, because we are merely depending on data, as we said. So it will let us to be familiar and encoding, and it's very easy, even so, to reach the data source. So it is easy to learn and apply and flexible across research context, and it's suitable for small and large data sets. As we said, we can use it in primary and secondary research. Limitations of the thematic analysis: findings may lack depth if not applied rigorously, and there is even so risk of oversimplification, and may overlook subtle linguistic newness, as we said. So we have to know when to use and when not to use thematic analysis. So we can use thematic analysis to exploring experiences, beliefs, and perceptions, and use even so to identifying patterns across qualitative data. And we have avoid it when deep discourse or linguistic analysis is required. So at the end, thematic analysis is most useful when the goal is explore experiences, perceptions, and perspective. However, it may not be the best choice when the research aim is theory generation or when a highly structured analytical approach is required. So in conclusion, thematic analysis offer a structured yet flexible approach to quantitative research when applied systematically and reflexively, and it allows researchers to transform individual voices into meaningful insights that can inform practice, policy, and future research. Thank you so much. My technical issue, I'm so sorry, I apologize. My technical issues actually led me to get so anxious.
Never mind, Dr. Malaz, and thank you so much for this great lecture and for explaining thematic analysis in such a practical and approachable way. And I hope you can solve the technical issue because we need you later on the day. Any question for Dr. Malaz? Any questions? Now we can shift to the next topic, which is called Elevenlabs AI, and it will be presented by Dr. Malaz Hammour. Artificial intelligence is rapidly transforming how we communicate, educate, and deliver care. Tools like AI-generated voice technology have growing relevance in telemedicine accessibility and patient engagement. Please welcome Dr. Malaz Hammour.
Hello.
Hello, Dr. Malaz.
Hello, everyone. My name is Malaz. Today, I'm going to talk about Elevenlabs. The screen is clear.
I think no sharing.
Why?
We can't see nothing.
Okay. Is it clear?
Nothing
You
still.
can hear nothing?
Mhm.
Still?
Yes. Nothing.
White. Can anyone share it, please? I will send it in WhatsApp. Dr. Ahmed?
I will try to share it. Okay, Dr. Malaz. Can you send it back to me again?
Okay. Just 1 minute.
And I will try to open.
I send it in WhatsApp.
Yes, Anna, I received it. I will try to open and share the screen.
Okay. Okay.
Is the screen? Can you see my screen now?
Yes.
Yes. Is it full screen?
Yes, it's full.
Okay, you can start now.
Okay. Sorry for delay. Okay. Today I'm going to talk about Elevenlabs. Okay. In introduction, Elevenlabs is an advanced AI voice platform that is specialized in realistic and expressive speech generation. It focuses on a text-to-speech, speech-to-speech, and voice cloning. Okay, what's the Elevenlab? Elevenlab is an AI company that specializes in voice generation. It converted text into realistic speech, transform one voice into another, and clone a human voice, control tone, speed, pitch, and emotions. It also offers free plan. Okay. Text-to-speech converts a written text into spoken audio. Choose a voice type, adjust the tone, control the speed and pitch, and add emotions. Okay. It also can be used for research because it can be used to create a high-quality voiceovers for academic presentations, explain research findings, and make studies more accessible to wider audience. Okay. In speech-to-speech, we can transform one voice into another, keep emotion and speaking style, can change the tone and speed as we need. Regarding voice cloning allows the system to learn human voice, then generate new speech and keeps a tone and emotion, sound natural and realistic. Next. Advanced voice control. Elevenlabs allow users to control the tone, adjust the speed, modify pitch, add or remove emotions. Why Elevenlabs is special? Because it's natural human-like voices, high-quality audio, easy to use, supports multiple language. In conclusion, Elevenlabs is a powerful AI voice platform. It focuses on text-to-speech, speech-to-speech, and voice cloning and offers free plan with an advanced voice control. Thank you. Really, I would like to show you some audio examples generated by Elevenlabs, but I don't know how with this technical issue. But it can adjust the tone and emotion based on how the text is phrased. And sorry for this technical issue. Thank you.
You can solve the problem, and we can show it at the end of the day if you can solve the problem as soon as possible.
Okay, thank you.
Thank
I will try.
Now we will shift to the next topic, which is called USEHR Landscape Top 3 MRs, and it will be presented by Dr. Hala. Electronic medical records are central to modern healthcare delivery, research, and quality improvement. Understanding the USEHR landscape is especially important for fellows planning to work or conduct research within the American healthcare system. Please welcome Dr. Hala. Dr. Hala, can you hear me? Dr. Hala, can you hear me? Dr. Hala. We can't reach Dr. Hala. I think she has some connection abnormalities. Are you available, Dr. Hala?
Available now. I just connected to my
Go ahead.
hotspot. Why? Let me
Yes,
just
go
share
ahead.
my presentation real quick. Sorry for that. Can you see my screen now? Hi, can anyone see my screen now so I can start?
No, we can't see it, Dr. Hala.
Okay, just a sec.
No,
Yes,
it's
we
good.
can see it now.
Okay.
Make it full screen, please, Dr.
Is
Yes.
it on full screen now?
Yes.
Okay, so
Great.
my name is Hala Eltayeb, and I'll be presenting the US EHR landscape, and I hope I can explain it in a clear and a simple way. So what are EHRs and EMRs to begin with? So EHR is basically an electronic health record. So it's a digital health record that is can someone can you see my screen now? I'm having a difficulty with showing my screen. Just a second, because I just missed my screen now.
We can we can see it.
Yes, so I can see it now. So it's basically a digital health record. It's basically designed to be shared like across multiple hospitals, multiple healthcare settings. And EMR is basically like a digital version of of a patient's chart within like a single organization. So we want to know like what's the main role of the EHR and why is it so crucial? So basically, EHR is it's basically used in most of hospitals, most of healthcare centers, and it's like a central hub for clinical documentations and workflows. And it's also very important for patient safety and population health, as well as it enables it enables care coordination, and it also like increases the efficiency, and it also like supports the quality reporting of patient records or lab or anything. Okay, so the US EHR market overview is we have the three top vendors that are used in the US is the Epic system, which I think most people are familiar with the Epic system because it's used by most hospitals, and we have the Oracle Health as well, and the Meditech. So these are the three dominated vendors in the United States. So to start with, we're going to start with the first, which is the Epic system. It is the market leader in the US hospital. So it's used mainly in large healthcare systems and academic centers and the large integrated delivery networks as well. So, and the acute market share is about 38 to 42%, which is dominant. And we're going to talk about more about the key strength about the Epic systems. So, first of all, to start with, it has a very, very strong interoperability via Care Everywhere. So basically, Care Everywhere is a network which allows patients' information to be shared securely between different healthcare organizations that use Epic. And the second thing is that regarding patient engagement, Epic offers one of the best patient portals, which is MyChart. It's called MyChart. So this portal, it allows patients to schedule appointments and message their providers and viewing test results and all of that. And then the third thing about Epic systems, it provides like a comprehensive coverage across almost all medical specialties. So it supports both inpatient and outpatient clinical workflows. And fourthly, it has advanced analytics and reporting tools. So this help healthcare organizations monitor clinical outcomes and to improve the operational efficiency and all of that. And then lastly, Epic also has a very strong, robust ecosystem and a very long-term. It also has like a long-term vendor stability. So this makes it like a reliable choice for large healthcare systems. Moving on to the next slide, there are some considerations that has to do with the Epic system. The first thing is that it has a very high implementation and maintenance cost, so it's a bit expensive. That's the first thing. And there's about the resource intensive. It's very intensive, like it requires substantial IT staff and resources for implementation and customization. Other than that, regarding the learning curve, it might be a bit complicated and it might be a bit complex for end users. So it does actually require like some training. You need some time to get into the system and understand every single bit of it. And then lastly, the last thing to consider about the Epic system is that it's not really ideal for small practices. So it can there's an overkill and a cost prohibitive for smaller and independent clinics. And now we will be moving on to the next AMR, which is called Oracle Health. It's formerly called Cerner. Oracle Health, it uses like an open platform architecture. And another thing to know is that Oracle Health, the target market for Oracle Health are usually large hospitals or mid-sized health systems and also governmental institutions. And also to add that the market share for Oracle Health is 22 to 23%. So it's like the second largest EMR. So we have the main key advantages of Oracle Health is that first thing is that the Oracle Health uses an open platform architecture, which allows healthcare organizations to integrate the EHR with many like third-party applications. That's the first thing about the Oracle Health. And then the second thing is that regarding the population health and analytics, the system it has a strong population health and analytics capabilities. So this helps, for example, this helps organizations analyze large volumes of data and manage, for example, manage patient populations more effectively and all of that. And then the third thing, which is the Oracle Cloud integration. So Oracle Cloud integration, it's like a potential, for enhanced performance, and data management through an Oracle Cloud infrastructure. So after Oracle Health being acquired, after Cerner being acquired by Oracle, the platform benefits from the Oracle Cloud infrastructure. So this improves the performance and the data management as well. And then the last thing is that Oracle Health is highly customizable, and it's also adaptable to diverse healthcare environments. Okay, so now we're going to talk about some few considerations regarding Oracle Health. First thing is that it uses a user interface. So to explain it in a simple way is that some clinicians feel that the user interface is less intuitive compared to other EHR systems. So this can affect the clinician satisfaction if you understand. So, and then the second thing is that regarding the implementation complexity, this means that the implementation of Oracle Health itself can be complex. It can be difficult and time consuming because it's still a large scale product. So it does require significant resources and planning. And then the third consideration is that there's some uncertainty. So customers may face ongoing adjustments and strategic shifts, and this can create uncertainty. The last thing also to consider is that Oracle Health, while it being an open architecture, this is a good thing, it being an open architecture, but managing many third-party systems does require significant effort. Okay, so this is the third, okay, so this is the third EMR, which is called the Meditech. This is basically the community hospital champion. So you usually find community hospitals using Meditech, and also the rural and the critical access hospitals as well. And also keep in mind it's the third largest. So the market share is around 12 to 15%. And the core philosophy of Meditech is just simply it focuses on affordability, because it is affordable, it is simple as well. So we can see the key strength of Meditech, as we mentioned earlier, that it's cost effective. So it's generally a more affordable option in terms of initial licensing and long-term costs. That's the first thing. The second thing is that it's cloud-based Expanse. The Expanse platform has a modern user interface, and this makes it easier for many clinicians to, like, it's easier to learn because it being modern. Third thing about the Meditech, it's typically quicker to implement compared to like the larger, more complex system. So it's very quick. And then the last thing about Meditech, it's very simple. So it also provides like a very responsive customer support, and this usually helps clinicians help them find it easier to deal with Meditech. And also there are some considerations that we need to know, is that first of all, Meditech may not offer the same depth of high, like, specialized functionality compared to Epic or Oracle. So it may not offer that same thing. And the second thing is that they had some market share loss because it has seen some larger hospitals like migrate to Epic over time, so like there was a share loss as well. And then the third thing is, while interoperability is improving, it is improving, but Meditech's data sharing network is not as extensive as Epic's Care Everywhere. So it's if you compare it to Epic, it's not that extensive. And then the last thing that people consider about Meditech is that Meditech like has created a perception that the system was less advanced. So although the newer Expanse platform had like it has significantly improved this, but some people still perceive it as like an old version. Okay. So this is just like to compare between the three systems. So Epic, as we said, that it's used in very large systems, and then Oracle are also used in large systems and governmental systems as well. And then Meditech, as we said, are mainly used in community hospitals and that. Regarding the cost, Epic is the most expensive compared to Oracle and Meditech. And also customization, Epic being the highest, and Meditech is basically like the simplest. Also, we talked about interoperability, and we talked about how Epic has the strongest interoperability, and Meditech is improving, but it's if you compare it to Epic and Oracle, it needs some improvements. Okay, moving on to the next slide. So the future of EHRs, we can keep in mind that we can ask ourselves our questions like, where is the market really going? And first of all, we can see like AI-driven clinical decision support in the future. So EHR systems will increasingly use AI, artificial intelligence, to help clinicians make better decisions. Okay, and then the second thing is that they will be a greater interoperability. So EHRs will continue to improve their ability, like to share patient data across different healthcare organizations by using the FHIR standards. And then the third thing is that about the cloud native EHR. So basically more EHR systems will move to like a a cloud-based platform. So this will allow for improving system performance and برضو, for example, enhancing security as well. Other than that, and also for the enhanced patient engagement tools, for example, few EHRs will provide more advanced tools for patients. So this, for example, such as better mobile apps, better portals, things like that. And then the last thing is there will be more focus on reducing the clinician burnout. So they're also focusing on that, to reduce clinicians burnout. And this will basically improve usability and all of that as well. So in conclusion, so the major takeaways are EHR is to choose the most suitable EHR. This is a strategic decision. And we also knew that Epic, Oracle Health, and Meditech, they dominate the US market. And also each system serves a different organizational need. And we also understood the strength and the considerations for quality care delivery. And thank you so much.
Thank you so much, Dr. Hala. Thank you for that concise and informative overview. The presentation clarified how EHR systems shape clinical workflow data, access, and research opportunities. And if anyone has any question to Dr. Hala before we shift to our final topic. Now we shift to final topic for today, which is about Canada's new changes for international medical graduates, and will be presented with Dr. Malaz Salah. Our final topic addresses an issue of great interest to many international physicians. Recent changes in Canada's approach to international medical graduates have significant implications for career planning and the training pathways. I am pleased to invite Dr. Malaz Salah once again.
Hello, everyone again. Let me just share the screen. Hello again, everyone. I'm Dr. Malaz Salah, and I will present Canada major changes for international medical graduates. So, as we know, across many healthcare systems worldwide, there is a growing gap between the increasing demand for medical care and the availability of doctors. At the same time, many international medical graduates are fully trained and experienced, yet they face long, complex, and sometimes unclear pathway to practice. So this imbalance has encouraged several countries to rethink how internationally trained doctors are integrated into their healthcare workforce. Against this broader background, during this presentation, I will focus in recent changes announced by the Canada and how these changes affect international medical graduates. So firstly, we have to know in Canada, physician shortages have become a persistent challenge across many provinces, particularly in rural and underserved areas. Although there is a strong need for doctors, the traditional pathways for international medical graduates were often slow and restrictive. As a result, Canada has introduced a series of reforms aimed at accelerating the entry of qualified doctors into the healthcare system. So let us firstly to overview of the changes. These reforms are built around three main changes. The allocation of 5,000 new federal admission spaces for doctors. Second, the creation of dedicated express entry category specifically for physicians. Third, the introduction of ultra-fast work permits that can be issued within 14 days. So let us see each one. Okay. First change. New federal admission spaces. Why this matter? Canada has created 5,000 additional immigration spaces reserved exclusively for doctors who already have job offers. Importantly, these spaces are added on top of existing immigration limits. This removes a major barrier that previously delayed doctors, allowing provinces to require physicians without being restricted by federal caps. The second change, dedicated express entry category. A dedicated express entry category has been created specifically for doctors, and physicians are now evaluated within a pathway designed to reflect medical practice and healthcare needs rather than being assessed alongside unrelated professions. So who can apply? Applicants are not required to meet all criteria. Meeting just one is sufficient, such as a direct attending level job offer, or fellowship level training, or at least 1 year of Canadian clinical experience. This approach focuses on doctors who are already to integrate efficient into the healthcare system. Third change is about ultra-fast work permits. What does this mean? Once doctor is selected by a province or tertiary, a work permit can be issued within just 14 days. Previously, processing could take several months even after securing a position. This reform allows much faster workforce entry. So, do doctors need license exams before a job offer? Not necessarily. Not necessarily. In many cases, doctors receive conditional job offers first and then complete license requirements afterward. However, full medical practice is not possible without completing the required licensing process. So how can IMGs, international medical graduates, secure a job offer? Most job offers are not come from general job websites. They are usually obtained through provinces' requirement programs, direct outreach to the hospital or practice ready assessment pathway. Flexibility is key. Doctors willing to work in rural or underserviced areas or have significantly higher chances. So in conclusion, Canada is taking clear and practical steps to address physician shortage. International medical graduates are now recognized as a priority group, while opportunities are expanding. Success is still depends on preparation, understanding the system, and securing a job offer. So these changes represent more than policy updates. They reflect shift toward recognizing international medical graduates as an essential part of the healthcare solution. Thank you.
Thank you so much, Dr. Malaz, for this important update. And I would like to especially acknowledge you for contributing to high quality presentation in today's session. Thank you so much. It's truly appreciated. Conclude, I would like to thank all members of Canary 2 team for their excellent presentation and thoughtful preparation. Thank you so much as well to everyone attended and engaged with today's session, and as well as special appreciation to Dr. Nader Abdurrahman for his leadership and the vision. And I can now move to an important segment of today's session. It's important to hear updates on the fellowship itself and the ongoing and the completed projects. It's my pleasure to invite Dr. Nader to share his insights. Thank you so much.
Thank you so much. Thank you all for great presentations. These are great topics, and thank you for contributing. You did a great work and a great job. So if you have any updates or any questions, please raise your hand or interrupt me. Can I just share with you two announcements? I'm very glad that Dr. Adam, can I share the screen here? Adam Ahmed from this program has submitted, along with his team, an abstract to the European Society of Cardiology, and that abstract was accepted. Thank you, and thankful. So Dr. Ahmed, he is applying, I think, this year, and this is about the program or the conference. It's going to be in Portugal in March of next year. So if you have any comments about that, or if you are in a team with Dr. Adam, I congratulate you and great job. The other announcement is that the post-acute and long-term medicine, which used to be AMDA, named as AMDA, the American Medical Director Association, they have their annual conference, and this will be, if you hit in the conference here, it's going to be also in March of next year in California. So they are still accepting posters, or that will, the abstract submission will close in January 5th. So we have about 2 weeks. If you are interested in submitting your work regarding any geriatric population, or specifically in facilities that has rehab or long-term care setting, then you can apply, and you can go to the website where you can submit the abstract there. If you want to look at their previous conferences, abstracts, and so on, this is the last year that was published in JANDA, one of their journal. So if you send your abstract and it's accepted, when you present it, it will be published as an abstract in their journal. These are some of the topics presented last year, and more on the list here. So if you want to have an idea about how you select a topic, how you present a topic, these are some of the examples that, and you can go by more than 1 year, like the year before or the year before. Or some of our fellows in this program, they presented different abstracts since 2020. So they have been participating in this conference all the time. If you are interested in a specific area, specific conferences, you can do the same. Write your abstract and see what the conference deadline for submission. Try to meet that deadline, and hopefully we will hear good news about your submission and abstracts. So that's the easier way. The longer way, you can write an article or a manuscript and submit it to a journal, and that also is doable, and you can work with other fellows to achieve that. You can go to previous work, you can convert the abstracts into papers and submit it to some of the journal as well. So there are plenty of opportunities for every one of you to participate and get some work. And hopefully you will learn and contribute to the literature. Thank you. Anyone with any updates, please go ahead. Any questions about the program or any ideas, any suggestions, any improvement that we can work on, anything? I'm working on developing some videos for new fellows so that we can orient them to what to do instead of coming and they don't know what the next step. So if any one of you wants to help in this as well, please let me know. If no more questions or any ideas, I'd like to thank you all. Thank you, Dr. Ahmed and your team for these great presentations. Thank you all who attended today's meeting. And I'd like to thank those who will watch the recording in the future. Thank you in advance, and I wish you all the best. Please contact me with any questions or anything I can help you with. You can send an email, text me, or call me. I'll be happy to help as much as we can. Thank you. Have a wonderful day and see you next week. Assalamu alaikum.
Alaikum assalam. Thank you very
Alaikum
much,
assalam wa
Dr. Nader.
barakatuh. Thank you so
Thank you,
much,
Dr.
Dr. Nader.
GB